Hi, I'm Virgil Walker with We the People, America in Black and White, and I wanted to talk to you about healthcare. This is again another healthcare segment. I wanted to walk you through. In the last segment, we actually looked at who was covered. We talked about the cost, and we kind of walked through how some of this is going to be paid for. I can guarantee you, if government puts out a program and tells you that it's going to cost, X amount of money, in this case, $871 billion. They say over 10 years, but in the last segment I explained that actually that cost is only over 7 years, and that the real 10-year value or 10-year amount is not really all that clear. If they tell you it's 800 billion, you can triple that or quadruple that and get an idea of what you'll actually see during that same 10-year process. They do a terrible job of kind of actuarial science. One quick example that comes to mind is the fact that, if we passed the TARP bill, we were going to see unemployment stay at 8.5%. Well, we already realized, we're at 10% and climbing, and the end is still not in sight. So just something for you to keep in mind. What I want to do with this segment is I want to walk you through some of the requirements that are going to be placed on you as an American citizen as health care is passed, at least the Senate version thus far. Now, this bill will go from once the Senate passes it, which will probably be Christmas Eve, because they're hoping that you're not paying attention. Once that passes, the bill will then be merged with the House bill. It'll go into committee, where you'll never see what's actually happening. You'll only be able to guess what's going on. Once they finish that process, they'll come out and there'll be that final combined version will be voted on in the House and then again in the Senate. What I'm hearing, though, is that there's a process that's being kind of placed, or some pressure rather, that's being placed on the House, where the president is actually wanting the House to pass the Senate version so that they can move on more quickly, with the goal being not that we actually get the best legislation, not that we actually have our voice heard in the process, not that we actually have representatives actually do what they're paid to do, which is represent our views and our thought process, but for the purpose of politically making this president look good at a time, as next year unfolds, and he's able to go do the State of the Union. The hope is that by the State of the Union address, the president will be able to announce that he's been victorious in passing health care legislation. Let's help that not to happen. When you look at requirements for individuals, and I'll be brief about this, run through a few things and move on. One of the requirements is that there's going to be a fine for those of you who choose not to pay for health care. There'll be a fine starting from $95 to $750. Now, while on its face that sounds punitive, it really isn't. The goal of the fine in the first place was to ensure that we had more young people who were paying their premiums and would offset the cost of health care for those who were older. The fines that are then being in place is to encourage the young person to go ahead and purchase insurance. Well, it's actually not going to do that, because the cost of the insurance will actually be the cost of the fine rather will actually be much less than the cost of the insurance. So what young people will do is they'll pay the fine with no problem. It won't cover the cost of an ever-increasing healthcare budget that will be exploding. And what they'll actually do is, once they get sick, they'll show up ready to receive healthcare, which the cost of which will be exponential at that point. This whole thing is just it's a huge Ponzi scheme. It's just unbelievable. Employers will also be paying a fine. If you have 50 or more employees, you're going to be required to pay a fine of up to $750 per employee if you don't pay for health care insurance for those employees. Now, that again may sound punitive, but in actuality it's not. And the reason why is this: the cost of a small employer paying for insurance is actually more than the cost of the fine. So what you'll end up see happen is you'll have a lot of employers who'll say, well, you know what, that's great. I can just pay a fine and they'll be dumped onto a public, a public plan, and that's what they'll do. The CBO, the Congressional Budget Office, estimates that somewhere in the neighborhood of between 8 to 10 million people will actually lose their private health insurance at their companies and be forced to pick up one of these options that the government is providing for them. So again, you'll see more and more people that are dumped off of their private insurance and who are now charged with the process of going out and paying for insurance that government provides. Again, the challenge with that is a promise that Obama made from the outset, where he talked about if you like what you have, you're able to keep what you have.
Let's set up a system where if you already have health care through your employer and you're happy with it, you don't have to change doctors, you don't have to change plans, nothing changes.
Well, it doesn't look like we're going to be able to keep what we have simply based on the fact that we like it. There's quite a few more things in place there. I'm going to stop here as we begin walking through some of the other issues. I'll walk you through some, the benefit package that the government's going to provide. I'll talk about, what the government-run plan actually is and looks like. We'll talk about the changes to Medicaid and other things as we move forward through this process. There's a lot to cover here. I want to be clear about it, and I want to keep it simple. I want to give you bite-sized pieces that you can understand. I'm hoping that helps. Looking forward to connecting with you on the next round. I'm Virgil Walker with We the People, American Black and White. Thanks for checking in.